Welcome to Talk of the Town. I'm Robin Zimmerman. We are at MiraSol Health on this beautiful day in Bluffton, South Carolina with Lynn King. She is the Senior Director of Business Development for MiraSol Health. Was on the board, but in January went on staff.
Welcome.
And you're loving it.
Welcome, I am, and I'm so happy that you're here and we have a chance to share our story.
I know. All right, so why is community education so important to MiraSol Health?
I think it's important for MiraSol Health to be able to share the programs and services that we have in the community so that people understand that we're not just hospice care. We're palliative care. We've got behavioral health. We have a vibrant volunteer program, and it lets us get the word out into the community so that we can help get our resources in front of people for them to make an informed decision about whether they themselves or someone they know could benefit from our services sooner than later.
So you have lots of audiences that you can communicate with and provide that education to. So what are some of the topics and where do you go?
Well, we'll go anywhere. We'll do service, civic organizations, church group, ladies groups. But what we do is we tailor the presentation for the group we're going to,
Right.
as small as it is or as large as it is.
Right.
We will focus on who we send to that presentation. And what we try to do is we try to explain what hospice care is, what palliative care is, and the resources that we have to be able to supply to the families and the patients. From a medical perspective, when we go to a doctor's office, we're able to tailor the presentation so that the doctors understand that we're not only helping their patients, but how that extra layer of service from us can help them as a provider.
So you mentioned the rebranding. So it was hospice only. Well, that was the name. And then we went to MiraSol, which has an umbrella for so many different services that the community doesn't know about.
They really don't know about it. And so the rebranding came about for several issues. One, there were a lot of people that were hesitant to even call for hospice, not knowing that hospice can help a lot earlier than like at the very end.
Right.
And so that was one thing, but then the other thing we learned is there was no way that someone was going to call to ask about palliative care if they were calling hospice.
Right.
But so we're trying to get the word out, and it's been we've got community partners, sponsors, donors that are helping us with that. But this community education program that we're doing really helps us get the information to groups that can then be ambassadors.
Right.
Whether they need our services or not, they know somebody that does.
And if they need to access care or a family member or a friend, now they know exactly what MiraSol Health provides.
Absolutely.
When you say, what do you enjoy about your job?
A lot of it. It was different being on the board, but what I enjoy about it is I've always enjoyed networking, and this is pure networking. It is bringing what you know about something that you're passionate about and delivering it to people that need to know whether they know they need to know it or not.
So you mentioned the word passion. So did it come from family with your parents and all of that, how you got involved on the board initially?
We talk about the professional why, or the why you're here. And I started professionally for 15 years working with Tide Point. And I would make referrals to people and tell them about hospice care of the Lowcountry. My dad was on service for 3 years before he passed away, and I know personally what they did for him and my family. And then my mother, who passed away earlier this year, was on service for over a year. So I have a personal and a professional why for doing what I do.
All right, so if someone wants you or someone from MiraSol Health to come and give a presentation, whatever, how do they
They just reach
access?
out. I'm sure you're sharing our information, but as Senior Director of Business Development, I'm happy to take that ask, and then we'll match up the need of the group. And so you just call our offices or look for us online.
And it's not always a speech or presentation. You can do like a small group discussion or one-on-one.
We met with 10 people at the one of the local churches. It was just kind of a church group that just wanted to know more about us, and it was very beneficial. And it's a way for us to get our information out, but we've also had them respond back. We've gone to Rotary clubs, we've gone to Zonta clubs. So we fit it for whatever the need is and the questions that people want us to answer.
All right, very good. Well, MiraSol Health is very blessed to have you, not only previously on the board, but now on staff.
And I appreciate you being here too. Thank you
so
for sharing
much.
our story.
Thank you so much. And that's it for this edition of Talk of the Town from MiraSol Health.